Hi, my name is Manelli, and I'm going to talk to you about hepatitis A today. What's hepatitis A? Inflammation of the liver. What does it cause? It causes abdominal pain, jaundice, nausea, and vomiting. How do you know you have hepatitis A? Typically, they'll go and run some blood tests. They'll check your liver functions. Now, jaundice has everything to do with the liver. If you are showing signs of jaundice or if you go into the hospital, yellow as can be, they will check your liver function to make sure your liver functions are doing good. Now, if they're not, they are going to suspect hepatitis A, ask you about your day, and see what happened. Now, are you going to know exactly what happened? Possibly not. You can be at a restaurant eating your favorite food, but that chef behind closed doors went to the bathroom, was such in a hurry and didn't wash their hands and continued to touch the food that you so enjoyed. Well, then you caught it. How do we prevent from catching hepatitis A? Hand washing. Every restaurant you go to, you see the sign that says hand washing before leaving. Adhere by it. It's the best thing you can do. Always carry hand sanitizer on you. I don't leave anywhere without hand sanitizer. I do believe that has to do a lot with COVID though. Now, when you are in the midst of having hepatitis A, you're not feeling good, you feel horrible, the best thing to do is, once you've been diagnosed with hepatitis A, of course, lots of rest, staying hydrated, and not overdoing it. Just stay still, relax. Now, if it becomes too painful as far as the abdominal pain, they will give you medication as far as like nausea medication, or they'll also give you pain medication to help with that. But as far as any medication to cure hepatitis A, it lets it run its course. Now, I have a close friend and coworker that is from Russia. She's been here since she was 23, and she herself caught hepatitis A when she was a younger girl. So I did go ahead and interview her, and she went ahead and told me her story, and this is it.
So my story is about hepatitis A, which I myself had it. So as you know, it is a vaccine. So I came from another country where hepatitis A is very common. And hepatitis A is due to infection, transmission through body fluids, touch, all that stuff. So I had hepatitis A when I was 16. We had outbreak in our school, so I guess all our kids mingle around. So somehow I caught it also. So how it manifested, I became jaundice. I was yellow from top to bottom. My eyes were like orangey yellow. My urine was orangey. I had a very high fever. I was sick as a dog. So in my country, the treatment was to put us in a hospital for isolation, and we were just getting IV fluids twice a day. That was the treatment. There was no medication. And so I was in the hospital for 21 days getting IV fluids for twice a day, and then I guess infection resolved and I was discharged and just went on my own. So when I was hospitalized, my fever was so high, and I didn't know what the fever was because the medicine back, we're talking about 40 years ago, was pretty so. But the fever was so high, I was hallucinating. My urine was yellow. I was feeling horrible. It was worse than having flu or any other those horrible things. So I was vomiting. I was very nauseous. I don't know about liver size because we weren't assessed that way, but the blood was not drawn either, so I was just tested to see what kind of hepatitis I had. And we had to be on a strict diet, of course. We couldn't tolerate any fat food or any greasy food, or it was very bland, very plain food, very light food, because you physically couldn't tolerate any food for a long time. So my symptoms started getting better probably in about week or two where I could even eat something normal. But first week I was very, very sick. It's a very, very difficult illness to go through.